Well, hello everyone. So my name is Belinda Paulson. I'm the Vice President of Program Services here at Gilda's Club South Florida. And we welcome you to our beautiful clubhouse. Have you all had an opportunity to take a look around and see? Good. I hope you feel very welcome and at home here. So Gilda's Club, we have been in this location 2 years, but we have been a provider of free cancer support services for almost 30 years. Our services include free support services such as counseling, support groups, educational programs, healthy living classes, and we have several initiatives, and one of our initiatives is our initiative to look at health disparities, our health equity initiative. And so we have our Women of Color programs to really provide education and access to free health screenings for women of color, among other initiatives that we have. And so it was a very natural partnership for us to be here and host this event and partner with Chef Charette and H3 and any organization where we are coming together to raise our voices around the issue of health disparities, but also mainly to really break some of those barriers and give access to care. Shouldn't be a challenge for one to be able to access good quality care. And so we are very excited that you all are here to join us for a very good discussion, an open discussion, and one that shows support for a community where the disparities are very clear, and we want to break down those barriers. But a few housekeeping, everyone who knows that we're here. If you need anything, see any of our team members while you're here, and we'll try to help and address those needs. At the end of this panel discussion, you will also receive an evaluation, a feedback form. Please share your thoughts with us and feedback so that we can always be here to improve our services and what we do. And also another piece is that we do have participants in online through Zoom, and we just want to welcome you all as well here. And we also are on Facebook Live. So we have many individuals who are watching from many different places, but wherever you are, we are so happy that we can come together as a community. I have the privilege to introduce our part. As I said, we have a couple of partners that put this event together, and Debbie Whitworth, there you go, from Chef Charette. Deborah has been a great partner. She has worked in education and nonprofit for more than 25 years. She's the Florida Program Coordinator at Chef Charette, where she has been there since 2019. She works with, her mission is to work with breast cancer and ovarian cancer and cancer genetics. And everything that they do is free and confidential. She's going to tell you a little bit more about her organization and sharing, and then she will also introduce our host organization moderator, who will then introduce to you our panel. So we're going to get there. We are going to get there. We are a team. It takes a community, a village, right? Yes. So again, thank you for your attention.
Right. Thank you. Thank you, Belinda. It really is a pleasure to partner with Gilda's Club South Florida, to partner with H3, as well as Touch the Black Breast Cancer Alliance. You should follow all of us on social media. No joke. Don't take out your phones now, but you should follow all of us on social media because there is so much information that we are all putting out there that will benefit you and those that you are connected to. October's Breast Cancer Awareness Month is here, and with it comes the bright pink reminders that breast cancer is so prevalent in our community. 1 in 8 women in general will be diagnosed with breast cancer in their lifetime. And for many, that risk is higher due to family history and genetic mutations. Sharsheret is the Jewish breast and ovarian cancer community. We focus on education in the Jewish community for hereditary breast cancers. One of the reasons why is because 1 in 40 Jewish men and women carry a BRCA gene mutation, which leads to a significantly increased risk for breast and ovarian cancers, as well as prostate, pancreatic, melanoma, and male breast cancer. There are many other mutations that are linked to these cancers as well. And there are other insular communities, like we were just, Dr. Ravix and I were just, not yet Dr. Almost Dr. Ravix and I were talking about the Haitian community as well. So there are other insular communities where you see this kind of genetic mutation within the group, and also the Inuit in Alaska. Sharsheret educates the Jewish community about these hereditary cancer risks, as well as offering cultural competency training to medical professionals. And we are still seeing, because of the pandemic, that people are not out there getting their routine screenings or even their well checks like they maybe were before the pandemic. We also see people are not returning to in-person events like they used to. With the option of hybrid, we're happy everybody is here in different formats. So during this month of pink, though, don't stop at awareness. So what I came to say is, let's turn it into action, right? Breast Cancer Action Month. Pick up the phone and schedule your screening, and I could not stand up here and say that if I didn't have my own mammogram last Friday. Ask your family about cancer history. What kinds of cancers or other medical pieces, what is happening in the family? Talk to a genetic counselor. We have a genetic counselor at Sharsheret. We have a genetic counselor here at our table. All the local hospitals have genetic counselors as well. Consider genetic testing if it's right for you. Someone this evening told me they just did an updated panel because they had cancer screening years ago. Now they've done an updated panel. Most importantly, though, pay attention to your body, because you know your body best. If something doesn't look right, something doesn't feel right, don't ignore it, check it out. Call Sharsheret or Gilda's Club or H3 if you're looking for support services or you have any questions. We are all here for you and here to support those facing breast cancer, ovarian cancer, hereditary risks for cancer, and cancer in the community as a whole. Sharsheret services are offered by phone and are all free. We even provide financial subsidies for certain non-medical needs like scalp cooling, or for wigs for women in treatment. So this October, and we have the rest of the month, it's only October 5th, let's make this Breast Cancer Action Month together. So tonight you're here because you are taking action, and you are in for an excellent in-depth discussion with a panel of experts. I'm honored to introduce our moderator, Jania Piazzetta, founder and director and a one-woman show of H3, Health, Hope, Healing. As a 19-year breast cancer survivor herself, Jania has devoted her work to breast cancer advocacy, education, and community outreach. H3, which just recently launched the Pink Ribbon podcast, was created out of a dire need to connect individuals with breast cancer with the resources and information needed to go through the cancer experience. And even that first initial instant fear of being newly diagnosed. In addition, there was the need to support to deal with post-treatment side effects, both physical and emotional, and encourage patients to be their own healthcare advocates. H3's signature event is the open panel discussion about cancer. Jania has spearheaded 7 open panel discussion programs, including during COVID, that bring together oncologists, pathologists, natural healers, breast cancer radiologists, genetic counselors, and survivors around a central theme. Last year, the theme was genetics, and this year, tonight, we're going to talk about the disparities of breast cancer diagnosis and treatment among Black women and cultural competency in the healthcare setting. Welcome.
Thank you, Deborah. Welcome, everyone, especially the virtual audience as well. It's my honor to be here today and share my work with all of you and have this powerful panelists with us today. So over the years, this event covered diverse topics, from rising cancer diagnosis to healthcare challenges and the future of breast cancer treatments. So today we have the 7 open panel discussion with a very special topic: Disparities Black Women Face in breast cancer diagnosis and treatment. Someone has to speak about that, and that person is me on behalf of H3. But before we start the discussion, I would like to go over a few minutes with our panelists. So basically, you have 3 to 5 minutes for the answer. And remember, we have 4 questions, and they're very much in depth. So it's going to take time. So remember, when you are 5 minutes, if you go over, you're taking the other panelists' time. So, and we have some extra time in the end where we're going to take some questions from the virtual audience and the present audience as well. So let's see. Our team of panelists: Alejandra Perez, MD, breast oncologist at Sylvester Comprehensive Cancer Center. We have a Tiara Neal, breast cancer survivor. We have Temi Adar, genetic counselor. Also, we have Jovanka Ravitz, MD and PhD student at the University of Miami Miller School of Medicine. So, as you're all highly accomplished, I won't be able to read all your bios and all your work. So why don't you introduce yourself one by one? You have like a minute. So let's start with Jovanka Ravitz, please.
All right, good evening, everyone. My name is Jovanka, as you know, and I am an MD PhD student at the University of Miami. So if you're not familiar with that training path, it basically means that I'm going for both degrees. So I want to be a medical doctor, and I want to get my PhD in cancer biology. And so I did 2 years of medical school. I paused medical school to begin my PhD training in the lab of Dr. Sophia George. And my research is on breast cancer and specifically looking at the disparity that exists within breast cancer in the context of Black women. We do this in multiple different ways. We're looking at genetics, but we're also looking at the social factors that contribute to our biology in many different ways. So this is something that I'm really passionate about. I'm so happy to be here and share as much as I can with you guys, and thank you for having me.
Hi, I'm Tammy Adar. I'm a genetic counselor at Memorial Cancer Institute. I've been there about 5 years. I've been a practicing genetic counselor in the area for about 17 years. And as a genetic counselor, I'm not a doctor, but I'm a medical professional who discusses hereditary cancer, figuring out who needs testing, and be able to discuss testing results with patients.
Hi, I'm Dr. Alejandra Perez. I'm the director of the breast cancer program at Sylvester Comprehensive Cancer Center in Plantation. We have satellites all over, not just Miami. So I'm in Plantation. I've been doing breast cancer work for 25 years. And as a clinician and researcher, looking at patients with breast cancer, of course, but also looking at the high-risk population, patients that don't have breast cancer, but they're at risk of developing breast cancer for whatever reason. So we take care of them as well.
Hi everyone, I'm Tiara Neal. I am a breast cancer survivor. I was diagnosed at age 33, no family history. I was diagnosed with stage 1 invasive ductal carcinoma. I had to advocate my entire journey, seeing as though I had no family history. I was turned away several times, and I had to fight to get the care that I wanted, unfortunately, with Cadillac, is what I like to call insurance. So I used to produce television, but now I oversee what's called the BEXA Equity Alliance, and we focus on underserved populations and women of color and ensuring that they have the same access to early detection of breast cancer as anyone else. It's truly an honor to be here with you all today. This is an extremely important conversation, and I'm really happy that I'm here to share with you.
So our seventh open panel discussion will focus in the following questions in depth. A culturally competent healthcare system is one that acknowledges the importance of culture, incorporates the assessment of cross-cultural relations, recognizes the potential impact of cultural differences, expands cultural knowledge, and adapts services to meet culturally unique needs. How can healthcare providers overcome cross-cultural communication barriers with patients? So we can start with you.
Okay, yeah, that's a very important question because we know that as providers, we're taught to practice empathy and compassion, and I feel like that is at the heart of every interaction you have with a patient, is to approach it with that mindset. And also approach it with the mindset that medicine is essentially a field of service. And when you're serving someone, the most important thing you need to do is listen and ask questions, open-ended questions from your patients. It's always good to have a basic knowledge of different cultural norms and customs, but that's not enough. You need to get your information from your patients, and you do that by asking questions and not making assumptions. So I think that the number one thing that we can do as providers in whatever capacity is listen to patients and ask questions. And if there's something you don't understand, ask another question to follow up and get clarity. I think that it's essentially a communication breakdown. And so that is something that we need to teach, even starting from where my position as a medical student, entrench that in our training so that we know when we interact with patients, the most important thing is that we're in service to them, and so we need to listen and ask questions.
I'm going to echo a lot of what you just said. Definitely with healthcare providers, we need to be able to meet patients where they are, not where we are, and be able to break things down into concepts that our patients can understand. In genetic counseling, that like half of our training was being able to take a complicated concept and make it into something our patients are able to understand. And if we break down those concepts and figure out how our patients are relating to everything, so finding their cultural understanding of everything versus what our understanding is, then we can have that better conversation, as well as being able to know about our local population and about our different cultures here. Thinking about this question, I thought about when I initially came to South Florida and I had one of my first consultations with a patient, and I always have to put down what country they're from, and so I put down Jamaica. And my boss was like, Tammy, Jamaica what? And because I wasn't from here and I didn't really know, how diverse a country Jamaica was, and that was a good wake-up call to really know that I had to understand my population there if I really was going to be able to talk to them.
Yeah, effective communication is key to build trust. And trust is everything between a patient and a doctor. If you don't trust your doctor, forget it, that doesn't work. Right? So effective communication is key. And I think as physicians and healthcare providers in general, it is our duty to understand the population we serve. We need to know who our patients are. And how do we do that? We do that through community outreach, we do that through asking questions, trying to get to know them. You need to have, when you have the patient in front of you, you need to understand what's their preferred way of communication. How do you want me to give you results? Do you want me to call you? Do you want to come to the office? Do you want somebody else to take the results? Get to know the family. Who is the person in the family that makes decisions? Is it you or is it somebody else? You need to be sensitive to a lot of different cultural aspects that you don't understand. You think that I'm the patient, I'm in charge, and it doesn't work that way in some cases, right? So you need to ask questions, who in your family makes decisions, how do you prefer to communicate with us, what is your perception about the disease, what do you think about cancer? What do you think caused your cancer? you'll be surprised the answers you get about what caused your cancer. What do you think the treatment, what kind of treatment you're gonna require? You need to understand perceptions because you get a lot of information from all of those questions you ask patients. Essential to have translators. Essential to, when I hear you saying about, a story about Jamaica, it's the same, for example, in the Hispanic community. We assume that because we all speak Spanish, then we're all the same. And there's nothing more different than somebody from Cuba compared to somebody from Colombia. I mean, totally like two different worlds, right? So you need to understand those cultural differences. And sometimes they're big, but sometimes they're very subtle. And also pay a lot of attention to the non-verbal language. You have a patient, you need to understand the cue that they're giving you. You really need to look at them. Some cultures prefer eye to eye, some cultures don't. Some cultures don't look at you. So those are the little things that are so important so you can build that effective communication and trust. And then from that on, that patient is going to be able to open up to you, to really share everything, all the questions and all the fear, maybe the mistrust in the system. So extremely important, effective communication.
To just piggyback off of all three of them, as a patient, a former patient, and survivor, I think it's important to be able to reach out and find out if your healthcare provider has had cultural compensate training ahead of time to know that you're going to be able to feel comfortable with that individual, sitting down and telling them and speaking with them and knowing that they've taken that step to understand you and your culture and being able to comfortably sit with you, because if they're not comfortable, then you're not comfortable, therefore you're really not able to effectively communicate with your doctor. And then another suggestion would be to find out ahead of time, if you do speak another language, reach out and find out if they have an interpreter there on the spot, or ask them if they have a resource, whether it's zooming somebody in who could interpret, so then you know that you're effectively communicating what it is that you're going through with your doctor, so you can feel seen and heard in that appointment. Because there's nothing worse than leaving that appointment and saying, I had this list and I had all of these things that I wanted to talk to my doctor about, and none of them got answered because I froze up, right? Because I understood that she couldn't actually hear me, but knowing that she can see me, that she can hear me, is extremely important. And another effective way of being able to communicate with your patients is also making sure that all of your communication materials, that when I walk into a room, when I walk into a location and I see that there's I'm being represented on the wall through posters, through banners, through all the communications. And if I speak another language and I ask them, I say, I can't understand this pamphlet. Do you have some communications in another language? And they say, as a matter of fact, we do. And they provide that. That to me just tells me right away that they are going above and beyond to ensure that I have the resources that I need to make sure that I'm making the right decisions for myself. So those are just some suggestions that I have from a patient's perspective to ensure that when I'm going in, that I'm getting everything that I need out of that appointment.
For the doctors here, when you were in school at the university, did they train you how to communicate with the patients?
I went to school many years ago, so things have changed. And let me tell you, we didn't get much. We didn't get much about that training, which was so important. I'm an immigrant to this country, and when I got here, I remember one of my attendings saying, in order for you to be as good as an American student, you have to be better. And that to me, said it all. And so we didn't get a lot of that, and that's a skill that I just gained over the years. I'm sure it's very different now, right? And I hope it's much better. Yeah.
So as a current medical student, so I can say that at the University of Miami, our curriculum very much emphasizes cultural competency. We actually have a completely separate class that is like, apart from learning about the heart, the lungs, all this stuff, we have a separate class where we learn different strategies of communication. We learn about different patient interactions that might be more difficult because you need to have a translator. So we literally learn how have a session with the patient using a translator. So it's very much being incorporated in our curriculum now, and I think that is wonderful because you might think these things are like common sense things, but no, someone needs to actually like sit down, formalize it, and sometimes once it's in the curriculum, that kind of validates it on a different level for students, because now you're being graded on how well you communicate with your patient. You know, you're being graded on if that patient walked away from that interaction, understanding the advice that you gave them in simulated sessions. You're being graded on that. So it definitely makes it, heightens the importance of like having this competency and apart from just learning all the medical knowledge that you need to know. So I'm happy to report that we're moving in a better direction.
I always say that as a Toastmasters, I wish that every doctor will have at least a year of Toastmasters so they will learn how to communicate with the patients. You know, it's very important. So our second question, what is the best way to get culturally and medically competent care to historically underserved communities? Meaning, why is cultural competence so important in healthcare, and how can it become a standard of care?
Yeah, so that's a really good question. And I think for me, I personally think the most important thing that we need to do is to diversify the workforce. There is still a huge gap of representation of Black doctors. Black people make up 13% of the population, but it's a very little percentage of the doctors that are practicing medicine. And that extends far beyond just the doctors, just the people that are interacting with these patients in general. There's just not a lot of diversity. And I think that that's important for us to address that issue. Because there have been studies, we have done research that has shown that there are better outcomes when a patient is being taken care of by a doctor that looks like them. There was recently a paper that came out in a very prominent medical journal about surgery that said that patients that have surgery from female surgeons have better outcomes. So we have done the work, and we know, we've done the work, and we know that diversifying the workforce is in our best interest. That's the best way that we're going to be able to really serve these communities. So now we need to be intentional about the initiatives that we're putting in place to make sure that people that look like me end up where I'm at. I can personally attest to how hard it was for me to get into med school. I was the first person in my family to graduate from college, and so I didn't really have a lot of mentorship and guidance. Like, this road into becoming a doctor, let alone a double doctor, has been very overwhelming. And so one of the things that I love about Miami is that there are a lot of initiatives that are focusing on students in 5th grade, 3rd, 5th grade, or in middle school, because that's where we capture them. And I like to do different outreach efforts by talking to students, because I understand how important it is for them to see someone that looks like them trying to pursue this path. So I think that our number one weapon is to really diversify our workforce, because we know that when we take care of each other, that's how we're going to get better. So yeah.
Definitely, cultural competence is so important, because patients aren't necessarily going to follow directions and do what they need to do if they don't feel that they're being heard by their doctors. There has been studies that show that when we have patients who have BRCA mutations, where we want them to potentially do risk-reduced mastectomy or having their ovaries out, our patients of color aren't doing that at the same levels. And good possibility here is the fact that we have that missing cultural competence, that they aren't quite hearing that is what they need to do, because they don't feel they're being listened to. And kind of echoing what you're saying is, we have to get this at the provider level. The providers that need to be trained in both cultural competence, in implicit bias, in anti-racism, and really have a good core amount of information there and training to be able to recognize their own biases so they're able to interact with the patients better. Definitely with genetic counselors, We had kind of a basic cultural competency, and definitely I've seen as the time has gone on, we've gotten more into depth of having better training, that we have an anti-racism course that's going on, and actually preparing for this talk, I had about a laundry list that I think would take me about a year to go through, between books and articles and websites and movies and webinars all about anti-racism. And I'm really happy to see that going on in my field, and I'm sure that would be great for it to be spread around.
I think there are two key aspects, and many more, but I think I try to concentrate on two. One, know the community you serve, and you're going to hear me say that over and over again, because I think it's key to really understand the community. We have a great opportunity to go to those communities through cancer screening programs. So if we take our mobile unit and go and do mammograms or pap smears or skin checks, just going to those communities, you learn a lot about it. You break barriers, and you understand the people you serve. So I think having the educational materials, trying to reach that community in many different ways. I think that's key. And then the other one that is very important, and you mentioned a little bit about that, is that we have to reflect the population we serve. And it's not just the Hispanic doctor taking care of the Hispanic patient. I think we also learn, and that's important, but we also learn a lot from colleagues. So I have a colleague from Nigeria, and I learned so much from her about the culture and what things are important. Or even in the events we have in the office, you celebrate Colombian Independence Day, and the whole office goes and eats arepas and empanadas with us, and you learn a little bit about the culture, and you know what a sombrero is, and or you go to the special celebration for Jamaica or for Haiti, and so I think having that very diverse population reflected in your doctors, your nurses, your staff, everybody is very important, and the patient is gonna feel much comfortable knowing that yes, they're gonna go to the office and you're gonna find people that can relate, that can understand. Sometimes the patients say something to the nurse and not to me, and then the nurse comes and says, look, she's concerned about this, but she doesn't want to say it to you. And so it's very important that we have that staff that reflects the community we serve, and for us to do everything we can to really get to that community. We were talking before, asking how many events you have in October. I'm like, I have one every day. But why is that? It's because we go to schools, we go to churches, we go to synagogues, and you ask people, okay, what is it from, what do I need to wear? Is this appropriate for me to wear to your church? What are you eating, and or what is the concern for that population, or somebody had a particular disease and they're mourning somebody that had a problem in the community. So you can get so many information from every single aspect, every single interaction that you have with your patients. It's just a matter of listening and be willing to really understand the community you serve.
So I'm going to piggyback on Dr. Perez, and actually, as a whole, really it is diversifying the workplace, because as a patient, there is nothing more refreshing than walking in and seeing, it doesn't even have to be your specific doctor, but walking in and seeing a woman that looks like you. Because instantly, whatever fears and anxieties that you had, for some reason, they go away naturally, because you feel that you're being represented in that space. So it's really just making sure you're extremely thoughtful in what your workplace looks like, because when your patients come in, they want to feel at peace. It's extremely hard as a patient to walk into a workplace and not see yourself represented. So diversifying the workplace, I would say, is key. It's number one. That is how you're going to ensure that your patients are going to keep coming back and that they feel safe and secure, seen and heard. And then also community outreach, that is humongous. Really partnering with leaders of that community, knowing your community, knowing what their needs are, and meeting them where they are, whether it's through, again, churches. I mean, you can go into nail salons, meet the women where they are, hair salons, you name it. If a woman is there, concerts. I've actually actually taken my organization to the One Music Festival and offered free breast exams at One Music Festival. And individuals said, no one's gonna go to a music festival to see Jasmine Sullivan and get a breast exam. We had a wait list of 100 women.
Wow.
I mean, this is what I'm saying. It's really meeting the women when we're talking about breast cancer where they are, because then they feel, wow, you're coming to me, you're providing a service to me at no cost, and you're really being thoughtful again in finding me. Because as much as I want to find you, there's something that's holding me back, and that's saying, I want to know, but I don't want to know. I'm a little scared, but I kind of want. Well, you're here, so because you're in my space and because you've come here, I guess I'm going to go ahead and get an exam. And that's, for me, I find that really excites women. It makes them feel that we're going above and beyond and ensuring that we know that you want to be, you may or may not want to be here, we're going to find you and we're going to ensure that you get the care that you deserve. Meeting the women on the
The next question is going to be 3 questions in 1 question. So I will be dividing A and B. What is the most effective way to increase awareness and access to care? Meaning, A, how can we empower Black women to be more proactive about their own health?
So I think that what we need to think about is, why don't Black women feel empowered about their own health? And I think that answer comes from many different factors, but we have to acknowledge the systems that are in place that keep Black women from the care that they need. I work at a free clinic in Little Haiti, and I volunteer there as a student. And I was amazed at how many patients just don't show up simply because they don't have a ride. And we take that for granted almost. We think that it's just so easy to show up at the clinic. This is important, this is about your health, you should be here, but sometimes that's difficult. There are systems that are outside of the control of Black women because we exist in a society that doesn't necessarily let us feel our value and our worth. And so there are so many barriers that come with that. And so why don't Black women feel empowered about their health? Well, Black women are subjected to a lot of stress because of things like racism on a daily basis. And we've done research to show that having exposures to chronic stress can lead to chronic inflammation, and that can lead to cancer development. So just, being an advocate for, breaking down these institutional and systemic reasons why Black people in general don't feel empowered about their health is important, and everyone can participate in that. Everyone can, educate themselves, as you were talking about being anti-racist and being understanding all the social things and barriers that keep Black women away from better health. But I think as a Black woman on a personal level, it's important to normalize, our health and our wellness. I can say that for me, I definitely grew up feeling like, everything is a grind and I have to be there for everyone. And, I think that's something that it's not unique to Black women, but I do feel like we feel that in a different way. And, we have to give ourselves permission to prioritize our wellness, permission to say, today I need to do this and I need to take myself on a walk. Or one thing that I like to encourage is, let's build community around wellness, because, people, we don't like to do things alone. I would love to have set up a weekly dance party, or just thinking of creative ways for us to be active and engage with each other. So I think we just have to be creative, because we know that Black women especially, they're in places where they may not have the same access to, green spaces to exercise, or, they live in a food desert, so that's somewhere where you don't have access to nutritious food. Or, because they're working 24/7, they don't have time to go to the gym. So we know all these things contribute to someone's health and their decision to promote their wellness. So I think that it's really up to us as a society to acknowledge the structural things that are in place that keep Black women from feeling empowered. And, you know, for Black women, so let's do this together. You know, let's help each other and prioritize our wellness, prioritize our needs, despite what we feel like we're expected to do as society.
And in terms of empowering, definitely education is a very important part, making sure people are aware of what they should know, what they should ask, knowing that information so that if they go to a provider who is shutting them down and they know, no, this is something I need to seek more care of, they can know that they need to ditch that provider and go to a new one that's going to listen to them. And by giving them information, we need to be proactive, going to the communities, educating people, talking to the community, talking to community leaders, and definitely making care more accessible, you know, different barriers to things like rides, insurance. You know, I've had providers who've been like, oh no, I only refer to these specific clinics and not to other specific clinics. Or, you know, I've had doctors who refused to let their patients go have a consultation with genetics and they needed that PCP referral to be seen. That's, you know, that really impacts the patient's ability to get that care. And of course, you know, representation and making sure, you know, patients will be more willing to go when they can see a much more representative provider group.
I agree, education is key, but education goes both ways. As a provider, I need to educate myself on what my patient is going through, and the patient has to also educate themselves about the resources that are available in the community. So education goes both ways. It's extremely important that we as doctors and providers understand what the barriers are. And because barriers can come in many different ways. It could be a financial barrier, it could be an emotional barrier. It could be a patient that is scared to come to the medical system. It could be mistrust. I don't trust the medical system. I don't trust that you're gonna treat me fairly. I don't trust that you're gonna understand my pain, my fear, my concerns. So mistrust is a big one, is a big barrier. And then we have a lot of other access to care barriers and how do we improve those. So education is key, and understanding what those barriers are extremely important. So we have that effective communication, and that we can develop programs at each institution to really help you address all those barriers and be able to treat everybody the same, because there are many studies that have shown that when patients have access to the same level of care, those disparities and those differences in outcomes change completely. So we can do much better, and it's very important for us to get the feedback, for us as big institutions, to get the feedback from those patients to see what do we need to change in the system, what are the programs that we need to create, and we're constantly doing that. But education and understanding what barriers we have.
So I'm going to address the elephant in the room, which is that Black women continuously die at a 40% higher rate than their counterparts, and that number and that needle has not moved in one too many years. So finding the solutions to finally break that barrier, to finally, you know, bridge that gap, because that gap has not moved in way too long. So we need to start to look at why that has not moved, and it is, you know, everything that everyone has shared thus far. But I think it's really, you know, I think that the Black community, Black women, we have to get out in the community and start spreading positive stories and letting women know, if you are diagnosed with breast cancer, if it's diagnosed at an early stage, you are going to be a survivor. It is a 98/99% rate that you will survive. You have a survival rate of a 98-99% if you are diagnosed at stage 1. So it's really getting into the community and having women of color, and sharing those positive stories that they've experienced as, you know, survivors or family members. You know, my mom, you know, she was diagnosed, I'm not speaking of myself, but I'm just giving an example of, you know, being in the community and sharing these stories of saying, you know, my mom, she was diagnosed at stage 1, but she's surviving, she's thriving. It's really having representation and knowing that women of color, yes, we may be diagnosed, but if we're diagnosed at stage 1, stage 2, even, stage 3 is a little hit or miss, but stage 1 and stage 2, you will survive and you will thrive and you will be able to share your story and save the women's lives who look like you. It's so important to have representation in that space as well, because not enough women feel comfortable sharing their stories. And I think it's because of, again, going back to those barriers, right? Because if I'm a Black woman and I'm, on my way to getting that promotion, and then I get diagnosed with stage 2 breast cancer, and I don't want to share that, because I know if I share that I'm diagnosed with breast cancer, that I might not get that promotion, and guess what? Then that's taking out of my children's mouths. That's taking out of all of the hard work that I've put in. But we have to change that narrative and be able to celebrate the fact that we are diagnosed at an early stage, and that we are survivors and thrivers. And maybe you don't get that promotion, but guess what? You are going to survive and you're going to thrive, and you're going to get another job, and you're going to be way better than what you were before. And I am a true testament to that. And that's why it's extremely important for me to be able to share my story over and over again, because I know that representation matters. I know that when I was going through my treatment and I started researching and finding other women who looked like me, who were survivors, and they were thriving, and I was like, wow, I can't wait to get to that finish line. I cannot wait to be just like her, so that I can share my story, so that other women are encouraged to say, I'm gonna start getting my breast exams, because I am comfortable knowing that if I am diagnosed at stage 1 at an early stage, that I'm gonna be a survivor and a thriver just like Tiara is.
Well, you all answered question B, so I have another question that, the other day I was part of a Zoom meeting from a Black group, and so they were saying that the Black community, Black women, they don't share their privacy or their financial situation. It's something that they learn to be very quiet. They also said that it's very hard to deal with a white doctor, especially if it's a male. They have no idea what a Black woman goes through every day. On that note, do you have anything to say, please?
Yeah, I think that goes back to, what I was speaking about before, about, having more representation so that people can be comfortable disclosing, those things like feeling, wanting to be private and having financial difficulties. That comes from building a relationship with your patients and gaining their trust. And so we know that when we have Black physicians taking care of Black patients, that the outcomes end up being better, because there is that lift of that barrier. But I guess just speaking to that idea of like how Black women are, private and learn to be private, and I think about that, and I think about how, for me, I can speak for myself as a Black woman, that you don't always feel like the world cares, You don't always feel empowered. You don't always feel like people really understand your struggle and they care about your struggle. And I think that is the reason for a lot of the, privacy around, health and finances, because you get to a point where it just feels like, well, this is how it is, and that's how, and it doesn't feel like it's going to change. It doesn't feel like, me saying anything is going to make much of a difference. But I think it goes back to what Tiara was saying about how, we need to share these positive stories about our interactions with the healthcare system. And I think that the more that we share with each other, even if we think everyone else doesn't care, but the more we share with each other and build community around each other, the more we can be more comfortable with disclosing these things. So, when I hear something like that, it really resonates with me, because I just think about all the reasons that, as a Black woman, I don't feel like, it matters. But, it does matter, because despite what you get from society, your existence is just invaluable. And so it's important that we, if anything, we build community around each other and we talk to each other about these things. And the more that we have providers that look like us and make us feel comfortable, I do believe that we will see changes in that sentiment as well. So yeah, that really resonates with me.
In terms of talking with privacy, of course, where my mind always goes to that is about family history. Because if you want to be very private with their diagnosis, if their family doesn't know about that, then they're not able to know how to best treat themselves. We have patients who've had younger ages of diagnosis, then their family members need to have their screening earlier, maybe genetic testing. And so it's hard when you have that feeling of privacy that the family members may not always benefit by knowing what's in their family history so that they're able to have hopefully more practice and then hopefully have providers who will listen and take that next step, because we do know with our Black patients that they're just coming in with family history, providers are not referring to genetics as much as they are to their white patients.
I think for women of color, when you face discrimination constantly, cancer is another reason to be discriminated against. So I think women of color and many other groups don't want to add that to the list. So we have to, we have to talk about it. You talk about the white doctor and how uncomfortable a patient is going to be with a white doctor. I think if we all make the effort, there's the white doctor is going to be white doctor all his life, but maybe bringing the nurse that is not white, and maybe bringing somebody, a member of the staff. I think we all have to put an effort to make the environment very comfortable for the patient. And I think one of the best ways to address all of this in the medical system is through the navigation program. Patients, they call the center, I have breast cancer, I need to see a doctor. The first person that is going to be there for the patient is a navigator. And navigators are going to address, at least in our institution, they're going to address every single aspect. Do you need a social worker? Do you need a ride to come to the appointment? Do you need any particular test that we can start expediting now before you see the doctor? Do you need a consult with a nutritionist? And the navigator starts that, and the navigator is able to really bring the patient in, facilitate everything in the center, address all the needs or fears or concerns that the patient has, even before the doctor sees the patient. The other day, I get it was a Hispanic family, and the daughters asked that nobody will tell the mom the diagnosis of cancer except for me. So the mom came to the office, and she didn't know she had breast cancer, but the family requested that I was the one that was going to give the information. We respect that, and the navigator communicated that to the whole office. So everybody, from the minute she got there, we all knew that nobody was going to say anything until I got there. Because that was the request from the family. So the navigation plays a very important role, and those resources are there in the community. You think about it, the first navigation program in the States was at Harlem Hospital in New York, and it was 30 years ago. And it was because they saw the barriers and they saw the need, so they created the first navigation program in the country. And nowadays it's mandated. Every big institution needs to have a navigation program. And there are laws. Congress has passed laws about having navigation available for all patients. So I think that's something that institutions really need to capitalize on, because it's very helpful.
I think for Black women, we recognize to this day, unfortunately, that racism is still alive and well. And what that looks like for us is it's better to just stay quiet, because when we get loud, individuals get uncomfortable. So what we need is community, others that do not look like us, to step up, to empower us, to speak words of affirmation on our behalf, to really advocate for us, because if we have that, then that allows us to start feeling safer, being able to speak up in rooms where we are the only one in the room. And I think for us that especially when it comes to cancer care, is extremely important, because to be silenced when you're dealing with something as big as cancer is extremely scary. and to be silenced to the point where you don't even share with your family because you're so scared to have that conversation. And what does that look like on your behalf? A quick story, 6 months prior to being diagnosed with breast cancer, I went in for my yearly checkup with my gynecologist, and I was 32 years old. And for the first time ever, I was so mortified and so scared to ask her because I knew she had a lot of patients and she was already behind. But it was my womanly intuition. I asked her for a physical breast exam. I have no family history, but something in me said, ask for that physical breast exam. And she turned me down. She told me that she had, and I knew, and I think because she was so far behind, she had women, there were so many women in her office. I had waited an hour and a half, but again, this is my 1 year visit, right? And because I was turned down in that moment, I know it wasn't her turning me down because she just felt like she didn't want to do it. I think it was because she said, you're young, you're healthy, you have no family history. It's really, you can do your own physical breast exams at home. I have so many patients I need to get to. But for me, that silenced me again because I said, wow, for the first time in my life I've asked for this exam. I don't even know why, but I can only imagine what that looks like for a woman who's extremely scared to go in, as I was myself. But then 6 months later being diagnosed with breast cancer, that is extremely scary because had I not advocated for myself, had I not been so aware of my breast health and checking in with myself, I don't know if I would be here today because again, I wasn't looking for anything. It really found me in a way that is really the grace of God and it's by the grace of God that I'm here today because it was a scenario where I was in pain and I felt what felt like a little pebble and everyone's like, you have no family history, it's nothing to worry about. But it was one person who said, you should just go and get a check. Just go get a check. And that's what I did and that started my journey. But I just think it's extremely important to always have individuals who don't look like us who advocate on our behalf and empower us to empower each other. So it's nice.
I'm glad that you're here with us today. The last question, it's a very in-depth question that I have a very special care about it. How do we address the need for research and clinical trial participation in Black communities, considering the past history of research abuse and failure to conduct demographically representative trials? And I would like to start that with Dr. Perez, please.
Research is a big problem for in the country, in the world. Why? Because we don't have good representation. If you look at the data, under 3% of Black women participate in clinical trials in the country. And so we know that all the studies that we have and all the approvals for the great medications we have really did not study Black women. So we don't know how those patients, how they're going to do. And so it's a huge problem. I think it all comes down to informed consent. And the problem with informed consent is that it takes time. And it takes a very willing physician to, and not just me, but the team, research nurses, research coordinators, to really spend the time, sit down with the patient, and explain why clinical trials are so important. We've talked a lot about barriers, about financial barriers and access to care and medical insurance and all of those things. But in terms of biology, the difference that Black women, Hispanic women, women in color in general, the difference in biology is huge. The worst two cancers in breast, inflammatory breast cancer and triple negative breast cancer, are more common in the Black population and are more common in the Hispanic population. So why is that? Why is it that the best form of therapy, hormonal therapy for breast cancer, most women are not hormone positive, and we cannot use the best therapy we have in Black women because Black women don't get hormonal cancers at the same rate. So there are a lot of differences in biology that we really need to understand why. And there's a lot of research going on, and you can speak about that that's her life. But there's so many differences in biology, genetics, why they have the BRCA mutation or the polyp2 mutation, or, and why we have a cluster of women in the Bahamas that have certain genes. And so there are a lot of differences in biology, and the only way to really understand that is through research. The only way we're going to find a cure for 100% of women is through research. So it's extremely important. I think informed consent is key. We need to sit down with the patient. We need to explain why we need to answer that particular question that we're trying to answer with that clinical trial. Why we need to know why women get more inflammatory breast cancer, why they're getting more triple negative breast cancer, what is it about the cancer that is unique, and also address the mistrust. You were talking about the injustices and the horrors that we had before, and we're very, and of course nowadays that's very regulated, and we have a lot of very important safeguards to really protect patients against that, and we'd like to think that that doesn't happen anymore. But it's also key to address the misconceptions and the implicit bias that we have. So I hear, for example, that patient is not going to accept the clinical trial, or that patient doesn't want to participate in the clinical trial, or that patient is not going to be compliant. So no, don't offer the clinical trial to the patient. Why are we doing that? That's implicit bias. You know, we really need to offer the patient the clinical trial, sit down with them, spend an hour going through it. And yeah, if the doctor is busy, that's why you have research coordinators, that's why you have research nurses, to really sit down and go over the why. Why is this important? Why is so important for a patient to participate in a clinical trial? So I know why, I know the side effects for that particular drug in the Black population, and or in the Hispanic population, or in the white population. But most of the clinical trials right now are conducted in the white population. The other thing that has changed that is good is we have to disclose the demographics. We have to say in the clinical trial you're going to see how many patients are Black, how many patients are Hispanic, Native Americans, white, all the races or ethnicities. You have to disclose that. That didn't happen before. So we didn't have transparency in terms of clinical trials. We didn't know who was that clinical trial done. And we also see global differences, around the world. So there was an important trial that that changed the standard of care in America, but the trial was conducted in Asia. And when we brought the same medication to the American population, we saw a totally different side effect profile. And there's something about the pharmacodynamics of the Asian population, they do different. It's the same thing with different populations here in America. So it's a very difficult subject. We're all trying to be very inclusive. We're all trying to spend the time having, for example, motivational videos, tools, information, pamphlets, things that the patients are going to go to the office and they're going to see, why should I be in this clinical trial? And it takes time, it takes effort, it takes will, but I cannot stress the importance of this. We really need good representation in every clinical trial.
I can definitely attest to that on the research side of things. So like us just trying to understand why this is happening, it's important to have representation in that aspect as well. I can tell you that as a breast cancer researcher, most of the cell lines that we use to do the experiments, to figure out the different drugs that are going to treat the cancer, most of those cell lines were derived from white women. There's not much representation of the actual models that we're using to learn about the cancer. And so one of the projects that I'm involved in right now is actually creating a cell line from a Jamaican woman with breast cancer, because we need to diversify, the models that are available for us to study cancer, knowing that there are so many different aspects that can make it different from person to person. Because cancer is a very intimate disease. Like, it's very personal. And so it's kind of just crazy to assume that like it's going to have this just blanket effect across the whole population, and the only way we capture those differences is if we have the representation. I need Black women to come in and to give their sample for research and to consent to giving their sample for research, so that I could take their sample to the lab and study their sample and learn from it, and try to figure out what is the differences and what are the targets. And we learn more about cancer the more that we learn about how it's different in different individuals. So that's super, super, super important. And I think it's also good, it's also important to remember, to realize that being Black in America means a lot of different things, but Black people in America come from all over. And we see that definitely in Miami, where we have so many different populations of Black people coming from different places around the globe. And so one of the things that my lab is very interested in is not just, okay, so we know there's a disparity of, you know, Black women and outcomes with breast cancer, but even within that disparity, there are some disparities. And so one of the projects that I'm looking at is Haitian women. My lab has done a lot of research just looking at different outcomes for Haitian women with breast cancer, and we find that of the different Caribbean islands that we're studying, that they have some of the worst outcomes. And like, so why is there a difference between a Haitian woman with breast cancer and a Jamaican woman with breast cancer? That even within that population, there's something to be discovered. But we don't get there unless we have Haitian women that come in and give their samples, Jamaican women that come in and give their samples, diverse representation of the group that we're trying to study. And so that's really important to my lab. And so I think about this question a lot because I want research to be a very important part of the way I practice medicine. And the reason why is because I understand that these disparities, they have social, my PI likes to say it like this. So they're above the skin factors that affect your health, right? You know, these are above the skin factors. So like the environment that you're growing up in, the food that you eat, how much exercise you get, you know, racism, being exposed to racism, those are factors outside of yourself that influence your biology. You know, epigenetics is a really cool field that I'm particularly interested in because it's talking about how, you know, these aren't changes in your actual DNA, but how there's different factors that can change the expression of different genes in your DNA, and they are influenced by your lifestyle. So it's important to understand that there are social things that are above the skin that directly impact biology. And so because we all come from different experiences, that's gonna manifest in different ways. But the only way I know that is if I have the samples to do the work. And so it's so important. And so when I'm involved in consenting patients, and one thing that I see in regards to the mistrust, I think it's important to acknowledge that that mistrust is valid. So if you have a Black patient and you're trying to get them to be in your research trial and they go on about Tuskegee or all these other, that is valid. That is a valid fear because, you know, science tends to be very isolating. You know, we kind of keep everything to ourselves. Like you know, there's not a lot of, you know, education and translation of what we're learning to the general public. So a lot of the patients that I consent, like I'll hear them ask, oh, well, can I get a copy of the research paper that comes from this sample that I'm giving you? And that's a valid question because they're coming in, giving you a sample. They want to be involved. They want to understand how is me giving you my blood or whatever it is, how is that going to advance the science? And so I think that science, the community of science needs to be more open and transparent about what we're actually doing and how this is helping us get closer to the cure for everyone. And patients want to be involved in that process. So when you are thinking about designing research studies and wanting to reach these communities, it should be important that, you know, you follow up with them so that they understand how they're contributing. And I think that would definitely help with increasing their participation.
When it comes to research studies, I really don't think we can accept research anymore that isn't more diverse representative of the community. You know, we have so many studies that are done just on a white population, and then it can't be extended out to everyone else. You know, most of the studies on how we do mammograms are based on most exclusively a white population. But that's not necessarily the case when we have a population that has more triple negative breast cancer than others. And we, you know, one example in genetics that I think about with this is something called polygenic risk scores. And it was this really cool thing that came out a couple of years ago where we could take a patient who doesn't have breast cancer and give them a very personalized risk for themselves for what their lifetime risk would be for breast cancer using both personal family history and genetic factors. And that was a really cool thing, but the studies were only done on white patients. So we could only offer the results to our white patients. And that's not equitable care. And so this was out for a couple of years, and the National Society of Genetic Counselors had a conference where we really did dig down into diversity. And one thing the Cancer Genetic Council came back and said is, we can't be offering a test that we can't offer to everybody. And the labs pulled back and either stopped offering it, or one lab did actually change into one that we could offer to all populations. But we really can't accept research that isn't representative of everyone.
I think the most effective way to encourage Black women, women of color to enroll in clinical trials is, again, meeting the women where they are. I partnered with Touch the Black Breast Cancer Alliance. Ricky Fairley, she is an incredible survivor, and she has a program called When We Trial, where she goes in the community, she'll meet the women. I think it's like, we go to the women, this is her quote, we go to the women where they eat, pray, slay all day, something like that. It's amazing. And she will go anywhere where Black women are being celebrated, and she offers them her story. And her story is that she was diagnosed with stage 4 breast cancer and essentially was told that she was going to die. She got offered an opportunity to enter into a clinical trial, and that clinical trial saved her life. So when you're being told you're stage 4 metastatic breast cancer and you are most likely going to die, at that point you say, well, there's a clinical trial that might save my life. I have nothing to lose at this point. So she enrolled, and it saved her life. And she's been, when I talk about the ultimate Black breast cancer survivor, it is Ricky Fairley. She is a mentor to mine, she's a partner, and she really is doing phenomenal work in helping to get Black women enrolled in clinical trials. And again, it's really just, she's going and meeting the women where they are and getting them excited about getting in these clinical trials, because she's explaining to them, listen, this saved my life. They didn't just, take my specimen and say, okay, you're gonna die, and you die, and this is a really aggressive way of explaining it, but it saved her life. And this is why it's extremely important to, again, have representation, to have a woman like her to go into the community and encourage women through sharing her story to enroll in these clinical trials. And women get excited, and they understand. They see her, they hear her story, and they say, I'm going to enroll in the clinical trial. She's got thousands of Black women enrolling in clinical trials. So again, it's getting the women over that hump to get them to understand that this is only for the benefit of Black women. It really is essential, it's critical, it's crucial to ensure that we are provided with the best possible care if we are in fact diagnosed with cancer. Because if we don't have Black women enrolled in clinical trials, we don't know what it is that our bodies need, because our bodies are not the same as that of our counterparts. It is not. So in order for us to get the proper care, we have to enroll in clinical trials. So I encourage all Black women to enroll in clinical trials. It is critical to our well-being and for our children.
What a great discussion. We spoke about so many things: cultural competence, better communication, education on both sides. We also talk about understanding community and its culture, the differences in biology and genetics, and so much more. So as a closing statement, I'd like for you panelists to give your final intake on this discussion, please.
Yeah, I say I want to just close with saying that this issue with the disparity with breast cancer, as you've learned, has so many different factors involved. But you know, we can encourage each other to be part of the solution. And I think for me, I found that I want to be part of the solution, and the way that I want to do it is by research and understanding, you know, what's going on. But I can't do that without the help of the community and without, you know, people giving research trials and giving their samples and participating in these trials. So I think that one of the things that, you know, we can do is encourage each other. If you have, if there's a research study going on that you qualify for, to definitely go for it. You know, there are different things in place to protect you as a participant, and so you shouldn't feel apprehensive about it. And I also want to say to Black women, it's just, it feels like another thing in the list of things. But I truly believe that we can help each other, and we can do that in so many different ways. We can lift each other up, and we can encourage each other to be proactive about our health in small ways. You know, go on walks with each other. You know, cook for each other. You know, and just build community around our wellness. I think that will also go a long, long way for us. And I also want to close with my spiel about just increasing diversity in the workforce. Just encourage your kiddos that are interested in science, interested in medicine. Encourage that and nurture that, because it's a hard road to be able to get to being a medical student. But you know, I do believe that the more representation we have, the better we're going to be able to address this issue. So definitely, if you take anything, participate in research, participate in clinical trials, and also let's encourage some more diversity into the workforce so that we can properly address this issue.
I want to close with just emphasizing, you know, a push to make our providers a bit more responsible for our population, for all populations as a whole, in terms of having the training to learn to not have biases, to be able to face, you know, anti-racism training, as well as to, you know, encourage a more diverse population and workplace. Because if we can encourage our providers to be more open, then hopefully we can serve all of the patients better.
I'm just happy to see that we're having this discussion because honestly, this started not long ago. I've been in this field, like I said, 25 years, and we didn't talk about this. This was never an issue, or we didn't think it was an issue. So the fact that now we're talking about it is so encouraging. And we have a lot of work to do. We're not near where we need to be, but at least the discussion started. And maybe it was one of the good things that COVID brought to us, that those disparities were so evident with the pandemic, that we all had to really pay attention to these things. And so I'm just happy that we're having this discussion. There's a lot of work to do. It's really an honor to be here with this panel. I look at the little ones here, this one here, and this one there, and what a role model to have, to look at some of our panelists here. It's just incredible what we can do together as a community. There's a lot of work to be done from our side as healthcare providers. There's a lot we have to learn. There's a lot we have to do or change, and also from the community. But know that we're here to help. We're here. We want to be educated. We want to help you. The resources out there. So just go and ask for it. It's your right. You deserve the good care that we can provide in the community. So just ask for it and just empower yourself to get the best out there.
Advocate, 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 advocate for yourself, advocate for your peers, your sisters, your moms, your friends, people who look like you especially, because if you don't advocate for yourself, you will not get to where you want to be, unfortunately. That is where we are right now, and And yes, we have a lot of work to do, but that doesn't mean that we are not going to put in the work for ourselves to ensure that we are all, and everybody in this room, we should all advocate for each other after this, I pray and I hope. But it's really important to know your family history in addition to advocating, right? And being comfortable and not being silent, being comfortable having those conversations at the dinner table and saying, hey, you know, we've never really talked about family history. I think we should start talking about our family history. Let's start doing the research in our family and knowing what that looks like so that we can be aware and knowing, you know, how we can best take care of ourselves moving forward and knowing that what could come down the pipeline, it could be cancer. So how can I ensure that I'm in early detection starting at a younger age? So it's really just important, and I plead that you all just really have those tough conversations, have those discussions with your family, discuss your family history. If you don't know any of your family history, go and find it, research it, beg your family members to speak about it, and don't be silenced, and advocate for yourselves. Again, it is truly an honor to be in this space, to be able to share my story, to be able to speak with you all this evening. This is an incredibly critical, crucial topic that should continuously be spoken about. I hope that this is just the beginning of this conversation in this space and multiple spaces, especially in South Florida. This panel is truly amazing, and I'm honored to just be in this space with these panelists. It's a very, very powerful panel, and I'm truly honored to be here with you all. So thank you so much.
As we see, we have a lot of work to be done in addressing breast cancer diagnosis and treatment in our Black communities. I really hope that this panel discussion has helped and opened the road for a dialogue so we can kind of solve these pressing issues. I really, really want to say thank you to this panel team. Thank you. You are amazing.